when plastic surgery goes well, people hardly even notice.
Yeah, but when it goes bad, well, that is a different story. John standing by with a cosmetic surgeon who has seen it all.
Yes, guys, we are joined by the good doctor, Terry Dubrow. He fixes failed plastic surgeries on the show Botched. He's also the host of a show called Licensed to Kill, which is a series that shares the stories of crimes committed by medical professionals. Perhaps you also know him from The Real Housewives of Orange County. Dr. Dubrow, good morning. Thanks for being with us.
Good morning. How are you, John?
Doing fantastic. So I want to ask you about this show, Licensed to Kill, because obviously as a doctor, you take an oath to do no harm. But this show exposes harm done by doctors. What has been the most shocking thing you have seen in this show?
I'll be honest with you. It's all so shocking. I've been a certified expert for the California Medical Board, and I've seen for years what doctors can do when they go off the deep end. Now, I want to remind you, doctors and nurses, 99.9% of the time are amazing. But when a doctor uses their specialized skills and training to do you harm rather than to help you, it's hard to tell they've done it. It's hard to determine there's even a victim because patients have diseases and they often succumb to their disease. But it's shocking what you can do when you know the human body as well as we do.
I think about this lots of times when I watch your other show, Botched, where people come in who have had bad plastic surgery and they come to you to fix it. And oftentimes I think when I look at these people, you know what? That surgeon never should have agreed to operate on these people. They have something going on inside. How much of your job is like a mental health evaluation of the patient coming in to ask you to do something?
Well, it's a huge part of the initial evaluation. You sort of ask them what their motivation is, get a sense of their personality. When you've been doing plastic surgery for a long enough period of time, you can instantly spot the red flags and whether their motivations are improper, whether they have unrealistic expectations, and sometimes their bad outcomes, they're a participant in it as much as the doctor is. You got to remember, plastic surgery is real surgery like cardiac surgery or cancer surgery, and it can have some real complications.
So I got to ask you this. You're an expert in plastic surgery. I would assume this means you can spot it better than the rest of us. Can you tell us a celebrity that you can tell has had something done that we might not recognize?
There is a very well-known cosmetic surgeon who's on a reality show on E! He's very short and very hairy, and he's had a ton of plastic surgery, and you can't spot some of it. A lot of it you can see.
Does his name rhyme with Raul Nassif?
He's had so many. How can you figure it all out?
Is he Dr. Raul Nassif?
Yes,
does it rhyme with that?
Exactly.
Yeah. Another question I want to ask you. Your wife, famously one of the housewives of Orange County, you've been on the show as well. Which one of her former castmates do you think has had the most work done?
You know what? It was such a memory of so long ago. I think I blanked them all out of my memory.
Guys,
I can't remember any of the former housewives.
That doctor.
I've displaced those memories with good memories from Botched.
That is a very skilled answer there, Doctor.
Yes.
Okay, so season 2 of Licensed to Kill premieres tomorrow, or excuse me, Saturday, 7 o'clock on the Oxygen Network. Doctor, thank you so much. Best of luck with the series. We appreciate you coming on.
Thank you, John.
Boy, that is a smart guy, right?
Yeah.
Very smart.
That was a tightrope, and he walked it.
You know, I'm a journalist, guys, and I hold people's feet to the fire.
There you go, because you are a journalist. That's right.